Even prior to the pandemic, managing to employ enough staff was a top 3 concern expressed by healthcare leaders across all sectors of the industry. And after the pandemic, healthcare employers have been struggling to come up with the quote unquote secret sauce to stabilize their workforces. The management of human capital has really taken center stage, so to speak, to make sure organizations can provide a full array of services and the high quality and safe care that residents deserve. Organizations realize that they need to address staffing from a new lens, focusing on comprehensive initiatives for recruitment, for retention, and for professional development to fully engage their healthcare workers more holistically. Today, we have Marcia Proto with us. Marcia Proto, MEDCAS, enjoys a successful career in state and national association leadership, nursing education and workforce development, healthcare fundraising, and statewide coalition building. She has built a national reputation as an innovator in creating healthcare and nursing workforce development strategies, and is the principal of Marcia Proto Consulting LLC, having previously held the role of statewide executive director for the Connecticut Center for Nursing Workforce, CCNW, for 18 years, transitioning from that role in June of 2024. Her life's work has involved connecting people through education and skills training toward fulfilling career paths, particularly in the nursing field. Marcia has spent the last 25 years ensuring that the nursing workforce will meet the nation's growing healthcare needs by contributing to and engaging in state and national task force activities such as the Center to Champion Nursing in America, a national initiative funded by the Robert Wood Johnson Foundation in collaboration with AARP. Marcia has a unique ability to transition and operationalize ideas into successful initiatives to support professional development and competency attainment for the healthcare industry, overseeing the creation, curriculum development, virtual dissemination, and evaluation for 2 national online programs to support the development of part-time and full-time nursing faculty to help drive the expansion of the nursing education pipelines in the United States that will ultimately bolster the nursing workforce. So via her vast network, Marcia has secured philanthropic gifts that enabled these programs to scale and meet the needs of different areas of the country. In addition to her leadership role with the CCNW, she's held management positions at the Connecticut Hospital Association, Junior Achievement of Southeast Connecticut, Flath and Associates Consulting. Today, Marcia is going to tell us what that secret sauce is. Welcome to the show, Marcia.
Thank you so much, Hannah. I'm so excited to be here. Healthcare is facing an exciting time of rebirth and growth, and especially from the home-based care aspect and sector, lots of exciting things are happening.
So, Marcia, let's start with how can home health and hospice agencies create a compelling employee value proposition to attract nurses away from hospitals or other settings?
Sure, Hannah. As you know, across the nation, we just don't have the N or the number of people, not only to fill healthcare jobs, but all other roles. So I think at this juncture, it's very important for organizations to really focus on and bringing their mission and vision to life. In healthcare, we have a unique mission and vision of healing and wellness. People are actually attracted to that because individuals want to make a difference and want to see that their efforts are really promoting somebody's health, bringing them back into their community and living whole lives. So how do entities compete? So really looking and bringing that mission and vision to life and trying to bring the culture of their organization to actually realize. So if it's promoting health, if it's community engagement, is an individual drawn to a home-based care entity or hospice entity because they see the culture of the leadership, CEOs, the chief nursing officers, the staff around them really engaging in that work. They're also looking for a positive team environment. As you know, many of the tasks and activities of our healthcare workers are not glamorous. Some are physically demanding. So we really need to find out first, does that individual who's expressing interest in working with us have a good fit? Because we really want to make sure we're attracting the right person. Because if we have an interested person, but they don't have a good fit, our organization is actually going to work really hard to make that person succeed. But ultimately, we know retention is a challenge. And
Yeah.
so if it doesn't align with a person's interests and competencies, as well as that organization's ability to support someone, that relationship of continued employment may not happen. So when you're looking at the secret sauce, living that mission and vision through a positive culture, making sure the people that we identify fully understand the role. That's the big thing. Sometimes people say, oh, I know what the role of a CNA is, a respiratory therapy aide is, or an LPN or a nurse, but they don't know what that role is within the organization. So a real clear job description helps build that understanding not only for the organization, but for the individual. And then if you're looking at wages, we talked about this in another conversation that we have. Entry-level wages for healthcare are kind of a bit precarious. Not only are we competing against the Starbucks and the Amazon entry-level roles, but our price point, if somebody takes the job, they may lose state benefits because it's too much to be on state benefits when you're getting support with childcare or food or housing, but too little to sustain yourself. So organizations are going to have to really decide what is that price point and what are my compensation and my other resources I'm going to offer. Do I offer child care tax credits to support that? Do I have a daycare around the corner that I could build a relationship with? So, what are those resources within their community, as well as resources that they're interested and capable of providing, in addition to a salary that's going to help attract somebody, the fit with hiring, and ultimately retain that individual within their organization? So, multifaceted response to the secret sauce question.
Yeah, and the creativity, right, that it takes to pull in some of those partnerships to see what you've got around you and to really get creative with building a package that works for the people who you want to attract. And I'm so glad you talked about leadership because leadership in creating that culture is such an important aspect. What do you think are the most effective strategies for recruiting and retaining these high quality nurses in this home health sector?
Would love to share that. So, Hannah, having experience of working with all the colleges and universities in Connecticut for over 20 years through my previous role and roles prior, um, most of the schools of nursing and allied health would love employers to knock on their door. I think right now, for employers to really attract, they need to get individuals before they even graduate from their programs. So, how can employers be proactive? Connect with the universities and community colleges and other certificate programs in their region. Share what roles are in demand for them as employers. And then share, we'd love to learn more of how we can partner with you. Maybe we can take a senior level student in one of their capstones and match the senior student up with a provider for shadowing and competency development. And I think now with nursing education, there was really never an impetus for that student to get experience outside of acute care or hospital based. Reason being is the national exam that LPNs and RNs take was very acute care focused. So when the schools looked to say, well, what kind of opportunity should I engage for my students? They were all acute care based, right? But now the NCLEX exam for RNs and LPNs is changing to a population based exam, not necessarily acute, more competency based, as well as the accreditation for these programs have really shared to say, no, we want your students to understand social determinants of health, population health, and where better to go than home-based agencies as well as hospice to get that understanding of what those community drivers are. So now schools and programs of allied health and nursing have opened their doors to home-based care and hospice organizations to say, let us learn more on how we can partner. That partnership will not only help indoctrinate a student before they graduate, but provide that student insight to a setting they never thought was possible. And if the culture and the leadership is providing a great soft land, the company won't have to really recruit. They're just going to seamlessly transition those students who have experienced what their organizations have to offer into employment. And so I think those, we call them academic practice partnerships, are critical. And I can guarantee if anybody's listening who's home-based care and hospice, if you knock on the door of one of the deans or directors within your state and in your community of nursing or allied health, they will welcome your call and they will say, how can we help? So perfect marriage, and the timing is right.
And I mean, you and I both share a background in education, and I would liken some of these programs to like a student teaching, where you're able to get in there, get some hands-on experience, get the feel of what it's like to be in a home, build a relationship with an organization that's already in place. It's understanding their needs, understanding the needs of the school that you're a part of. The more we can have these collaborative efforts in this communication, the bigger the win for everybody involved, because ultimately it's going to create a better educational experience that lends itself to a realistic job afterwards, which I think, and I think you share this, is going to reduce burnout. So
Oh.
what are some of the things you're seeing leaders do to reduce that burnout?
And if I could just hop into one of your phenomenal points before we touch on burnout, I
Sure.
forgot to share. So, in the state of Connecticut, but all across the country, there's entities called the Workforce Development Boards. Each region within a state has a board. So, in Connecticut, we're very small. We only have five workforce boards. Most of those entities had gotten significant dollars from the American Rescue Plan. And it is to identify individuals in the community who would like to go into healthcare roles. And they're supporting those individuals, paying for their education, and also seamlessly trying to transition them into the workforce. But one thing that has spun off of those workforce development boards are called regional sector partnerships. And in the state of Connecticut, three of our five workforce boards have a regional sector partnership for healthcare. The reason that's important is our state, along with I forget how many other states in the country, a year and a half ago, received $27 million for good jobs. So many of the roles in healthcare are good jobs. So these regional sector partnerships are bringing together academe, practice, community-based agencies to help fill the roles in demand. So home-based care and hospice can also find out through the workforce development boards if they have a regional sector partnership to become part of it. Again, as the American Rescue Plan monies wane in 2025 into each state, the good jobs money is starting to gear up. So could provide a wonderful segue for employers to get a continuous feed, not only of potential qualified students or recent graduates, but get money to support their entity for hiring, recruiting, and retaining staff. So
Where can somebody find more information about that?
So they should go to the Workforce Development Board in their community
Okay.
and ask if they have what's called regional sector partnerships.
Okay.
That's the Department of Labor term. But if they don't, they could also ask, do you have a healthcare workforce development program? More than likely, that workforce board has money that can support them.
Very good.
Yeah, yeah,
Okay. I hope
wonderful.
anybody listening who wants to get more information can take some time and take those steps and find out if and what you have available to you.
Yeah. So going back to your burnout question, Hannah, we have had burnout well before COVID. We had burnout during COVID, and my heart goes out to all of the healthcare workers who were in the healthcare environment working with patients and their families during COVID.
Yes.
Heroic efforts, the service above self and putting your patients and clients before your families, we saw that. So
For
we
sure.
truly can expect that many individuals who are in the workplace today, yes, are burnt out. What can employers do? First thing is the employers need to have open communication with their employees. They need to better understand where the mindset of their employees are. Convene brief focus groups of different types of roles. Because as we know, Hannah, home based care, you're out there by yourself. You don't have a team of colleagues that can say, Hannah, you look off today. Take a breather, I'll get your patients. No luxury there. Same thing with hospice. Unfortunately, had an uncle recently received the best hospice care and a beautiful death, if you want to call a death beautiful.
Yes.
But the emotional energy that the hospice nurses, not only dealing with him as the patient, but the family, it must be overly consuming. So make sure, whether it's from your human resource function, your service line function, or I would even step in to say the CEO, he or she, or they should be very active in creating a real mindful plan of how we're going to engage employees. We did read that one of the large providers in acute care gave out raises to everybody. I think the money is a wonderful motivator, but I believe it's a one shot just in time. People forget. And so a month
Yeah.
goes by, nothing's changed in the, as you've said before, the workplace culture. That money was nice and in my mind, way overdue, right? But that culture hasn't changed. So making sure we have open communication. And then when we get the information from the groups, to think about it and feed back to those groups we received the information from. Did we capture this correctly? And then ask, if we were to do one thing within the next 6 months, what would you like to see us develop? I think where many leaders get trapped, they read some great articles that, oh, this was the silver bullet with company A, or, oh, gee, my colleague did this and it worked. But we are not comparing apples to apples. Maybe we don't have such a mature staff, right? Maybe we have new people. New people coming into the industry are looking for different things. So you alluded to as well, that flexible compensation package. I don't have young children anymore. I did when I worked at the hospital association. So boy, that child care tax credit meant something to me, right?
Yep.
Didn't mean something to my colleague. So how can we make sure we're expending the money that we're allocating for our compensation is meaningful to the employees? So listening, making sure we're aligned with our resources, assist with burnout, but also giving people planned time off. Making sure our managers are reaching out to their staffs to say, Hannah, I see you haven't taken a day off in a month and a half. I strongly encourage you to take a Monday or a Friday just to get a breather.
Yep.
Even if, Hannah, you don't do that immediately, you know that somebody is recognizing in you that maybe you need some self-care first before you can, re-energize in your role.
Money is nice, but it's not what makes life rich. What makes life rich are those other things, the people you work with, the care that you have taken of you and that you get to take of others. That is really what gives life a deeper, richer meaning. And so when you belong to a company that takes the time, right, to say, hey, I'm concerned about you and I just want you to know I care. And if it's the right time for you to take a day, just take a day to yourself, pick your feet up, read something that brings your soul some joy, do that. And I think that does go a long way. There are people who are mission driven and people who are money driven. And I really think this is a field that has people who are more mission driven, and it doesn't have to be completely one or the other, right? We can have a mix, but I think there's a driver that is primarily the one that keeps the foot on the gas. And this industry is that mission driven industry. And so I think sometimes we do have to pause and think about how we create those balanced packages that really create meaning, whether it is the childcare, whether it's credits for going back to school and continuing professional development, or it's I don't know, a group to belong to, an exercise program.
Mhm.
That's something that comes to my mind when I think about home health and hospice workers, because I know they spend a lot of times in their car. And so sometimes it's difficult to plan meals that are healthy and think about exercise regimens when you're dropping off kids and running here and there. And the last thing you feel like doing is running somewhere in the evening. But anything you can do to get a pulse of where your staff is and what's going to be meaningful to them. And then within your power, if you can do it, why not?
Right. And you brought up a great point, Hannah. And I've had this conversation numerous times over the last 6 months since I transitioned out of my role specifically for nursing. In the area of leadership, because
Hmm.
many home-based care and hospice entities are so flat, meaning it's a working director, and then you may have one very thin layer of a chief nursing officer, et cetera, and then the CEO, to provide opportunities for that senior leadership to go for education, to really understand what is motivating. I just had a great conversation this morning that those individuals who were in their formative years during 2010 have a whole different mindset and are much more individual focused, where the previous generation was very team focused. So that is going to give a pause of mind to say, if I bring a new employee into my organization, how do all those generations line up? Again, many times, if you look at home-based care, individuals go there to sunset their career. They take all their expertise, their passion, and knowledge. They are at the top of the game, providing care in a home-based environment where it's their jam, right? So,
Hmm.
boy, home care has such skilled labor. How is that pool of providers then engaging those who have been there maybe, 5, 6, 7 years? And then how does that group engage those who are just starting? We know in healthcare we get a lot of career changers. So sometimes we do have a mature individual who's starting out as a novice practitioner somewhere along the continuum. But many times we really need to say is, how are we making sure we're communicating through all of our staff to have them work as a team? And I think you spoke about that earlier, that concept of a team. In a facility, it's much more visual and evident. In an organization that has a dispersed workforce, very hard to do. So depending on where you're located in the country, depending on your patient populations, depending on your resources. And I know that, reimbursement for care for home-based care and hospice is very challenging. There's not a lot of slush, but professional development wise, how can our team of senior leaders within these organizations either mind to say, who do we have amongst us who can share these with us, do in services, and or if you're looking at your academic practice partnerships, maybe those academicians can come and do free in services for them because you're providing a clinical experience. So I think there's a lot of negotiation and bargaining, which didn't happen before, but I think now symbiotically, it's best for everybody. So could be wonderful opportunities to lie ahead, thinking out of the box and being creative and understanding your specific workforce. You can then begin to step by step address culture, identify those stressors, and address burnout amongst your staff and prevent it.
And then those career pathways, when you have someone who comes in, whether they are new or you're thinking of ways to engage them long term, how can agencies develop more robust career advancement pathways and professional development programs that will keep nurses for that long haul?
And Hannah, so we know some larger organizations have multiple resources and they're multiple states. So they have their own internal departments that really can provide all of this professional development because it's built into their organization, but the one-offs may not. A great first step is to go to your state trade association. As you know, Every state has a home care organization. Ours is the Connecticut Association for Healthcare at Home, and Tracy Wodach is the president. They offer constant education programs for their members at very reduced prices. They also have CEs, so those that need any CEs, continuing education, to sustain their license. Great option. Sharing what those interests are for programming. The beauty of the trade association is they can listen to all their members and say, gee, it seems like 62% of our membership is asking for X. They're able to develop a program, whether it's a 1 day, whether it's a series, etc., to meet the needs of many, right? So that's a great option. Those um, workforce development boards, through their regional sector partnerships, expressing what the need is. They may say, gee, you mentioned this for home health, but all of a sudden, this manufacturing company or this finance company is asking for the same thing. They too have money, dollars, and access to consultants that could provide free work. And then any professional association, like the Connecticut Center for Nursing Workforce, or Connecticut Nurses Association, when I was in the state leadership roles, we would collaborate. They stepped up, our Nurses Association, during COVID to build in resilience, mentoring, coaching opportunities to support the workforce. Many of those education programs were recorded. They now have series, pre-recorded series that an employer could purchase to share with their employees at a very nominal price. So I would share with home-based entities and hospice who are looking for professional development. Don't open your checkbook and start to hire a consultant because it could be really expensive. I would check with their state trade association, the professional associations, as well as the workforce boards to see if they have money to support paying for programming. At one time, there was something called incumbent worker training that also came through the Workforce Development Board, where if you were looking at an entry level role who had interest and capacity to move up or wanted to gain a certificate in wound care or dementia, etc., that workforce board would pay to get a trainer to come in to provide wound care training, to provide mental health training, to provide dementia training, all free of charge. So I think the moral of the story is the more the employer assesses what his or her needs are, not only for their leadership, but for their employees, they can best articulate their needs to the players within the state who actually have resources and networks to bring these things to life.
And we have a lot of great state associations. I know it can vary by state as to how active they are, but from my experience, they have great resources. They're always willing to help. And I think they have capacity to bring to the table a lot of those resources and may know things that you're right. Don't just open your checkbook and pay for something outright before you stop and find out what you do have. So, and we're not talking about just a way to call and complain. We're talking about actually bringing something constructive to the conversation. So, what could someone Google to find out what is available in their state?
They should definitely Google their Department of Labor. Their
Yes.
Department of Labor are the ones who would receive any federal funds. Departments of Labor go out constantly to seek federal funds, but also funds through Health and Human Services and not your traditional Department of Labor feds, but they look all around what are the needs. I would definitely go to grants.gov. There's probably, I don't know, 500 to $1 billion that's available through grants.gov. It is challenging if you're a one-of entity to apply, but if you get a collective or you say, gee, this is pretty interesting, go to my state association or my workforce board, they could actually gather a few home care agencies in the region and apply on behalf of the group. And the beauty
There's
of the
power in
federal
those
grants
numbers.
is they are multi-year. So it's not just a one shot. They're between 3 and 5 years, which when you look at an opportunity, you're not only affecting new hires and current hires, you're also positioning your organization to be a soft land for future hires. So that's the beauty of the Fed system. Going to the different states, actually, after the American Rescue Plan dollars were awarded to our small state of Connecticut for the COVID, we got 1 billion in total. They had created what was called the Office of Workforce Strategy. It's not our Department of Labor and it's not our workforce boards. It was another entity, but that's where the federal dollars were flowing through. So it's called, if you looked under the governor's workforce council in somebody's state, they would have fishboning under that. Did they have a workforce committee? Did they create a brand new office? So those offices, at least in Connecticut, held a lot of money. And then they even created a new entity called the Connecticut Health Horizons that Connecticut, we were awarded 24 million for nursing education and scholarships for that. So you never know what state entity is working with that office to create a sub pot of money.
Little bit of a soapbox here. If you're somebody who is hoping for change, reach out and be the change, be a part of the conversation. People in offices and on committees may not know what exactly you are struggling with. And by being a voice, you create that meaning. You can help create the drive that makes ongoing change or makes those adjustments that are going to make it successful. And chances are, if you're having those struggles, so is someone else.
Exactly.
So when it comes to attrition, what metrics and KPIs should executives track to assess the health and sustainability of their own nursing workforce?
One of the challenges with attrition is many times organizations don't have a mechanism to assess why someone's leaving. So the first thing an organization should put in place is the exit interview. So they should have some standardized questions that they can ask their previous employees or the employees that are transitioning out. What were those drivers that made them go someplace else? It could be salary down the street is $2 more, but that employer should understand that that's what they're competing with. I also think related to metrics is we want to make sure people aren't leaving one division, one department, one service line, which could allude to there may be a person who is in a manager's role who may not be open or receptive to feedback or change. And so people, as you know, when they leave organizations, they really don't leave the organizations, they leave because of a person. And so I think when you start to go upstream on that, how effective is an entity working with his or her directors to be mindful of getting in touch with their employees, taking the temperature and finding the pulse of either a group of workers or individually so they can hear what's going on and be proactive to addressing. When somebody walks out the door and attrition happens, that decision was made 6 months ago. So I think going upstream, I was on a board and I was the one who kept saying every month when we met related to the nursing, what is our retention rates? And everyone's like, why would you care? I'm like, because strong retention rates actually attract more nurses. If you have a high attrition rate, people say, why are they leaving? And they'll look someplace else. We have so many other roles. So if you're looking at team leader meetings quarterly or monthly amongst the leadership, they need to ask the workforce-oriented questions, not, gee, what's our reimbursement and what's our census? We know that drives and keeps our door open. But if we don't have providers to provide the care, we're actually limiting our income, especially in home-based care. We lose a few providers, we now can't take care of some patients because we don't get that reimbursement dollar. So I think home-based care and hospice should even be more acutely aware of what can we do to minimize attrition, as well as what incentives can we provide our employees to bring in someone they know. How great is that? You're
The
bringing in
referral program. And if they're happy where they
exactly.
are, it's going to make Let other people want to come.
Exactly, exactly. And I think also by the referral, that individual has a true understanding of what the environment is, and so wouldn't bring somebody in if they felt they would be overwhelmed, right? Because that would lend poorly. Suppose you recommended me, I went in and then I left in 4 months, then you feel bad and I feel bad, right? And
Yeah.
so you'd only recommend somebody who you think would be real successful in that role. So I think there's a lot of opportunities when it comes to attrition to really reflect and say what's important. Something as simple as making sure you're on the bus route. And that was something that came out of one of these regional sector partner meetings. There was a bus that kind of went in the area of this one long-term care facility, but didn't stop there. They asked transportation, could you possibly do it? Transportation says, yes, I can. So now they had a whole pool of people to say, gee, I now can be an accessible employer because I'm on a bus route. Now, would that really help with home-based care and hospice? Not necessarily, but it was that entity who thought, what was impeding me for getting quality people and
Mhm.
what could I do?
What's the harm in asking? If you can think of a creative way to solve a problem, ask for it. The worst you can hear is no.
Exactly.
How can technology and remote work options be leveraged to enhance job satisfaction and work life balance for home health nurses?
Well, I think, Hannah, now is an unbelievable opportunity. Both of you and I attended the NAC conference back in October of 2024 in Tampa. I was floored related to the number of technology companies that are coming new into the market, and then some who have been there for a long time, whether it be the remote monitoring, what component of a home-based care and hospice provider is the monitoring, what of that can be done in a relatively seamless way and not as cost prohibitive to engage in that type of service. Others are offering a third party to do much of this work. So, does it make sense to the provider, and would they glean enough revenue to make it fiscally responsible to be hiring the third party? Can AI be used to look at case management and planning if we have specific populations that are grappling with the same disease state? What kind of interventions for COPD and other chronic conditions exist that could be leveraged to take that burden off of that nurse to keep developing and checking, but having the AI run through to say, gee, no outliers, stay the course, or bing, there's a flag, we really need to readjust what we're doing to enhance this patient's outcome. Depending on populations, there are different technologies that home-based care and hospice providers can take advantage of. Um, I don't know for the smaller provider if those technology vendors can come to a price point that makes sense, where a larger provider may have more volume and could make sense. So that would be a great question to ask any technology provider that, what is your optimal size? What's the scalability? And then also truly, Hannah, what have been the outcomes? The organizations don't want to jump just to jump. And I think a lot of organizations are jumping to use tech because everyone's using tech without really following up to say, well, what have your outcomes been with like organizations like mine? What have been the pitfalls? What has your organization learned as a provider, technology provider, and how have you enhanced your systems? So I think we as consumers need to be much more educated, but also ask those hard questions to demonstrate that there's a real benefit.
Well, for one, what's the implementation like? Because that's where a place where staff, especially, can become very frustrated. So when you're looking at technology, it's not just the tech piece, it's how is this going to work for my staff? Does it increase time? Does it increase job satisfaction? Does it increase my finances? And so when you're looking at something like a talk to text program that's AI enhanced, how is that saving me time? What's the ROI on that? Is it easy to implement? Are we using something today that we already, like an EMR program? A lot of EMR programs have some of these features, but agencies may or may not already be utilizing some things that they don't know they have. So I've seen in more than one instance where agencies have a documentation management system already that they have the box, they just haven't opened the box and used it, gotten it out, and kind of put it together the way that it works for their organization. So if you are already using a technology, be sure that it's being optimized. And then if there is something missing in your tech stack, and I know for Health Rev, we offer the Velocity technology, which becomes an operational platform and sits on top of your EMR and helps with those predictive analytics for finances and claims forecasting and things that if you don't have that, that is a huge missing piece that will affect your workforce, that will increase satisfaction and ultimately help you connect those clinical, financial, and operational pieces of your business. So,
And Hannah, you hit the nail on the head, and you're exactly right. Unless we have our end user evaluate the tool, have
mhm.
an opportunity to ask those questions, to gain insight and understandings, then their operations folks go out and get it. Then on the implementation side, it's not seamless use. It's more encumbered. And then, as you alluded to, staff would then do workarounds because it's not as easy I thought it was, but I'll use it, but I'll have to do this to get that to input here. So a real team approach in really looking at how will this intervention scale the resources that you have, you know, how does it then go through the organization to make information readily understood that that employer can make decisions on to put them in a better position, either clinical outcomes, fiscal, revenue cycle management, et cetera. So exactly.
So Marcia, we've kind of given a lot of secret sauce, if you will. This is a lot of information and it can be overwhelming. But if you're an agency who's wanting to bolster your workforce, where would you start?
So the first thing I would do is reach out to your colleges, universities, or other proprietary programs that offer education for roles that you're seeking. That is a hands down number one. Schools need to know that you exist because they always look for clinical experiences, whether it's a full clinical immersion as a part of a course where their students are building competencies, whether it's a shadow program, whether it's a capstone program. And those programs are actually being offered quite more frequently, really trying to, if a student had an interest in a specific area, give them that one-on-one immersion. And usually it's for a semester. So how better to share with a school to say, this is what my environment does. These are how our providers impact. And here are outcomes that if any of your students are interested, we'd love to have you. So I think there's a beautiful symbiotic relationship. Plus, as we alluded to earlier, schools could then offer in negotiation some professional development classes that could be consumed not only by employees and providers who deliver services, but your leadership as well. So that's the first number one. The second one is definitely going to your workforce development board in your region. They're the ones who are meeting with employers, listening to what the needs are, and trying to align funds, resources, and pathways to get people into the healthcare, into employment settings, and specifically you're looking for healthcare. Again, they may already have something up, and then ask about the regional sector partnership. Can they participate? So that's number two. And number three, really get involved with your local state trade association for home care and hospice. They may already be working on things that you're not aware of. And then I'd also say, Hannah, for some of the leaders in that employer to lean in and participate on some committees. Not that they have to jump on the board, but the more you're involved and you listen, you're able to align and then you're able to reflect and say, this is excellent. And there's another opportunity too. Because remember, many of the trade associations only get their information from those members who speak or from the national as it comes down. So, how does somebody at the trading association synthesize to say this is what we need? They need more information, so they want to hear from the home based care and hospice. So those would be my top three to really get them moving in the right direction. And the trusted partners, vendors like yourself and others. There are some wonderful trusted partners that go beyond the walls of their product service.
There are, yeah.
Those are the people you want to engage in because they're going to tell you if their service or product really just doesn't fit yet, but call me back in a year when you're here, right? Or we're just in development of something. So I'm going to call you back in 6 months because I'd love to talk with you. But those trusted advisors, I think, are invaluable in today's setting because the employer will benefit from everybody's lessons learned, right?
Yeah, such a great point. Marcia, you are such a wealth of knowledge, and thank you so much for agreeing to come on and talk with me today. If our listeners want to talk more with you
Oh,
or
sure.
connect with you for consulting projects, will you tell us how to get in touch with you?
Oh, sure. Thank you, Hannah. Very kind of you. So the easiest thing is to pick up the phone. And it's funny because a lot of people don't like to pick up the phone, but we can get so much more done by the phone. So that number is 203-494-1121 or Marcia Proto Consulting at gmail.com. My website is coming in March, so right now that's where
Oh,
we're going.
exciting.
But I'd be happy to talk with anyone to point them in the right direction and give them some insights.
Well, thank you again. Really appreciated getting the chance to talk with you.
Oh, pleasure, Hannah. And you've been wonderful, and your organization does such wonderful work for home-based care and hospice. So thank you for leaning in and sharing the podcast and providing more values to
Thank you.
your clients.
Thank you.